Hello, I'm Amit Bahl. I'm a consultant oncologist in Bristol, and I'm privileged to be the clinical co-lead of the National Kidney Cancer Audit. The audit process is to look at, from the time of diagnosis, the investigations that are done, how the diagnosis is established, and then the management of this group of patients, looking at various factors regarding the different technologies that are used, the different resources that are used, and thereby also looking at the outcome figures from this. This is really important because whilst there have been significant advances in the field of kidney cancer, we know that optimization of the treatment pathway and ensuring that there is efficiency across the board will result in further improvements which should be replicated across the country, and this audit will generate the data to support that. So the data that is being gathered has been guided by the clinical reference group, which are still going to meet and complete the data set that will be looked at. But the formative data set is quite extensive. It's looking at the patient characteristics. It's looking at the resources that are there. It is looking at the type of investigations that these patients have, then the results of the histology, the type of surgery or systemic treatment or radiotherapy or newer modalities of treatment that are being used. And we are also looking at the teams performing these procedures, the workload involved with it, so that we can look at the outcome data as regarding the resources that are there. Absolutely. I think, just for example, the National Prostate Cancer Audit has been very instrumental at looking at the different types of treatments that have been provided to patients, the support that the patients get, and there are learnings from there. And equally, we've seen how impactful that data can be in improving the patient pathways. And we hope that the National Kidney Cancer Audit will have similar impact and potentially will benefit patients across the board in the country. Well, of course, we'll wait to see the full data and make a very informed decision because these are important aspects. But one thing is very clear, and this is across the board in cancer treatment, that services need to have the support, they need to have the expertise, and we want to ensure that we have patient outcomes matched to the expertise levels. And if that is not feasible in a local area, then that can be coordinated with the regional center. And hopefully that should then enable patients to get the advanced technologies which can be centralized in certain parts of the country. Very excited and actually very privileged to be part of this audit. And this is not just a privilege, but it is a big responsibility. And I really want people to take part in this audit, support it. And I think it's only when we have the support from across the teams that we will be able to really achieve the vision of providing the data to strengthen the services to improve the patient outcomes.